Question 1. Analysis of an operative report detailing a laparoscopic cholecystectomy with intraoperative cholangiogram and exploration of the common bile duct for suspected stones, where the surgeon documents performing a separate incision for the exploration. The RMC must determine the most appropriate coding sequence and modifier usage based on the provided documentation and standard coding practices. Option A. Code the laparoscopic cholecystectomy and the intraoperative cholangiogram, and assume the common bile duct exploration was performed laparoscopically without separate billing. Option B. Code the laparoscopic cholecystectomy and the common bile duct exploration, but do not code the intraoperative cholangiogram as it is typically included in the exploration. Option C. Code only the laparoscopic cholecystectomy as it is the primary procedure, and consider the other services as incidental. Option D. Code the laparoscopic cholecystectomy, the intraoperative cholangiogram, and the common bile duct exploration, utilizing appropriate modifiers to indicate separate procedures if applicable and ensuring NCCI edits are considered. The correct answer is D. Code the laparoscopic cholecystectomy, the intraoperative cholangiogram, and the common bile duct exploration, utilizing appropriate modifiers to indicate separate procedures if applicable and ensuring NCCI edits are considered. Explanation. This scenario is professionally challenging due to the inherent complexity of surgical coding, particularly when multiple procedures are performed during a single operative session. The RMC must possess a thorough understanding of CPT coding guidelines, payer policies, and the specific documentation provided by the surgeon to ensure accurate reimbursement and compliance. The risk of undercoding or overcoding is significant, impacting both the healthcare provider's financial stability and patient care continuity. The correct approach involves a meticulous review of the operative report to identify all distinct surgical services performed. This includes understanding surgical intent, anatomical location, and whether procedures were bilateral or unilateral. The RMC must then apply the National Correct Coding Initiative, NCCI edits, and payer-specific bundling rules to determine the primary procedure and any separately reportable procedures. This adherence to established coding guidelines and payer policies is crucial for demonstrating compliance with regulatory frameworks such as the Centers for Medicare and Medicaid Services, CMS, guidelines, which govern Medicare and Medicaid billing in the U.S. Accurate coding ensures appropriate reimbursement for services rendered, prevents claim denials, and supports accurate data collection for healthcare quality initiatives. An incorrect approach would be to simply code the most complex procedure without considering others performed. This fails to capture the full scope of work and violates the principle of reporting all medically necessary services. Another incorrect approach is to code every procedure listed in the operative report without applying NCCI edits or payer bundling rules. This leads to overcoding and potential fraud, as it bills for services that are considered integral components of another procedure or are otherwise not separately payable. A further incorrect approach is to rely solely on the surgeon's suggested codes without independent verification. While surgeon input is valuable, the RMC bears the ultimate responsibility for accurate coding based on established guidelines and documentation. This reliance can lead to errors if the surgeon's understanding of coding rules is incomplete. Professionals should employ a systematic decision-making process. First, thoroughly read and understand the operative report, identifying all procedures, their anatomical locations, and any modifiers that might apply. Second, consult the current CPT manual and relevant payer policies to identify appropriate codes. Third, apply NCCI edits and payer-specific bundling rules to determine which procedures are separately reportable. Fourth, document the rationale for code selection, especially in complex cases, to support the coding decisions if audited. This methodical approach ensures accuracy, compliance, and ethical practice. Question 2. Stakeholder feedback indicates a recurring issue with the interpretation of physician documentation containing abbreviations and potentially ambiguous diagnostic terms. A physician's progress note states, patient present with SOB and CXR shows infiltrate. Suspect PNA. As a registered medical coder, RMC, operating under U.S. regulatory frameworks, which approach best ensures accurate and compliant coding in this scenario? Option A. Query the ordering physician for clarification on the specific diagnosis and the findings of the chest X-ray. Option B. Assign a code for shortness of breath and a generic code for pneumonia based on the abbreviation and suspicion. Option C. Code based on the patient's reported symptoms of shortness of breath and assume pneumonia is the confirmed diagnosis. Option D. Use a general code for respiratory symptoms and defer coding the specific diagnosis until further documentation is available. The correct answer is A. Query the ordering physician for clarification on the specific diagnosis and the findings of the chest X-ray. Explanation. This scenario is professionally challenging because it requires the registered medical coder, RMC, to interpret ambiguous diagnostic and procedural terminology within the strict confines of U.S. regulatory frameworks, specifically the Health Insurance Portability and Accountability Act, HIPAA, and the Centers for Medicare and Medicaid Services, CMS, guidelines for accurate medical coding. The RMC must ensure that the coded information accurately reflects the patient's condition and the services rendered, which directly impacts reimbursement, quality reporting, and patient care continuity. Failure to do so can lead to claim denials, audits, and potential fraud investigations. The correct approach represents best professional practice because it prioritizes obtaining clarification from the ordering physician. This aligns with the ethical obligation of an RMC to ensure coding accuracy and completeness, as mandated by professional coding standards and regulatory bodies like the American Health Information Management Association, AHIMA, and the OPC, which emphasize the importance of clear and unambiguous documentation. By seeking clarification, the RMC upholds the integrity of the medical record and ensures that the codes assigned are supported by definitive documentation, thereby complying with HIPAA requirements for accurate and secure health information and CMS's guidelines for proper billing and reimbursement. This proactive step prevents misinterpretation and ensures that the final coded data is a true reflection of the patient's encounter. An incorrect approach that involves making an assumption based on common medical abbreviations or similar-sounding terms represents a significant regulatory and ethical failure. This violates the principle of coding based on definitive documentation, as required by CMS. Such assumptions can lead to inaccurate coding, potentially over- or undercoding services, which can result in fraudulent claims or improper payments, violating the False Claims Act and HIPAA security and privacy rules by misrepresenting patient data. Another incorrect approach, such as coding based on the patient's stated symptoms without physician documentation, is also a regulatory and ethical failure. RMCs are bound by the documentation provided by licensed healthcare professionals. Coding based solely on patient self-reporting bypasses the physician's diagnostic process and is not compliant with CMS guidelines, which require all coding to be supported by physician documentation. This can lead to inaccurate medical records and improper billing. A third incorrect approach, which is to use a generic code when specific terminology is present but unclear, is a failure to adhere to coding specificity guidelines. While it might seem like a safe option, it does not accurately represent the patient's condition or the services provided. CMS and ICD-10-CM/PCS coding conventions require the highest level of specificity possible based on documentation. Using a generic code when more specific information could have been obtained through clarification leads to less precise data, impacting quality measures, and potentially leading to incorrect reimbursement. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the medical documentation for clarity and completeness. If ambiguity exists in diagnostic or procedural terminology, the primary step is to query the ordering physician for clarification. This query should be specific, referencing the unclear term and requesting definitive documentation. If clarification cannot be obtained, the RMC should consult official coding guidelines, coding clinics, and potentially senior coding staff or a coding supervisor for guidance, always prioritizing documentation-based coding and regulatory compliance. The ultimate goal is to ensure the accuracy, integrity, and compliance of the coded data. Question 3. The evaluation methodology shows a patient encounter where the physician's documentation indicates a patient presented with symptoms of shortness of breath and chest pain, and after diagnostic workup, was diagnosed with acute bronchitis and a history of stable angina. The physician's notes primarily focus on managing the acute respiratory symptoms, with a plan to monitor the angina. Which coding approach best reflects the principal diagnosis for this encounter according to U.S. regulatory framework for medical coders? Option A. Code acute bronchitis as the principal diagnosis, followed by the history of stable angina. Option B. Code history of stable angina as the principal diagnosis, followed by acute bronchitis. Option C. Code only acute bronchitis, as it was the primary focus of the physician's management during this visit. Option D. Code both acute bronchitis and history of stable angina as secondary diagnoses, with no principal diagnosis assigned. The correct answer is A. Code acute bronchitis as the principal diagnosis, followed by the history of stable angina. Explanation. The evaluation methodology shows a scenario where a medical coder is tasked with assigning ICD-10-CM codes for a patient encounter involving multiple diagnoses. The professional challenge lies in accurately reflecting the complexity of the patient's conditions while adhering to coding guidelines and payer-specific requirements, particularly when one diagnosis is significantly more impactful on the patient's care and resource utilization than others. Careful judgment is required to ensure that the principal diagnosis is correctly identified and that all relevant secondary diagnoses are sequenced appropriately to support medical necessity and optimize reimbursement without leading to upcoding or fraud. The correct approach represents best professional practice because it prioritizes the accurate identification of the principal diagnosis as defined by coding conventions and payer guidelines. This ensures that the primary reason for the encounter is clearly documented and coded first, followed by secondary diagnoses that provide additional context or impact the patient's management. This aligns with the fundamental principles of medical coding compliance, which aim for accurate representation of patient care for statistical, clinical, and financial purposes. Adhering to the official ICD-10-CM coding guidelines is paramount, as these guidelines are the authoritative source for correct code assignment in the United States. An incorrect approach that fails to identify the principal diagnosis correctly leads to a misrepresentation of the patient's condition and the services provided. This can result in inaccurate statistical data, improper reimbursement, and potential compliance violations. For instance, coding a less significant condition as the principal diagnosis when a more definitive one exists for the encounter violates the principle of coding the condition chiefly responsible for the admission or encounter. Another incorrect approach might involve omitting relevant secondary diagnoses that contributed to the patient's care, thereby failing to provide a complete picture of the patient's health status and potentially understating the complexity of the services rendered. This can lead to inadequate reimbursement and a failure to meet payer expectations for comprehensive documentation. The professional decision-making process for similar situations should involve a thorough review of the entire medical record, including physician documentation, diagnostic test results, and treatment plans. Coders must consult the ICD-10-CM official guidelines for coding and reporting and any applicable payer policies. When documentation is unclear or conflicting regarding the principal diagnosis, the coder should query the physician for clarification. This iterative process of review, guideline application, and physician communication ensures accurate and compliant code assignment. Question 4. Research into the application of ICD-10-CM coding guidelines reveals a scenario where a patient presents with symptoms of shortness of breath and chest pain. The physician's progress note documents these symptoms and orders diagnostic tests, but does not explicitly state a definitive diagnosis at the time of the encounter. The coder is tasked with assigning the appropriate ICD-10-CM codes. Which of the following approaches best reflects adherence to ICD-10-CM coding guidelines and professional best practice in this situation? Option A. Assign a less specific ICD-10-CM code for a general respiratory complaint, as a definitive diagnosis has not yet been established. Option B. Query the physician for clarification on the definitive diagnosis or the reason for the encounter, providing specific details about the symptoms documented and the diagnostic workup. Option C. Assign an ICD-10-CM code for a more severe condition, such as acute myocardial infarction, based on the symptoms of chest pain and the ordering of cardiac diagnostic tests. Option D. Assign ICD-10-CM codes for the documented symptoms of shortness of breath and chest pain as the primary diagnosis, as these are the presenting issues. The correct answer is B. Query the physician for clarification on the definitive diagnosis or the reason for the encounter, providing specific details about the symptoms documented and the diagnostic workup. Explanation. This scenario is professionally challenging because it requires the medical coder to interpret and apply complex ICD-10-CM coding guidelines to a patient encounter where the documentation is ambiguous regarding the primary reason for the visit. The coder must exercise critical judgment to ensure accurate code assignment, which directly impacts patient care documentation, billing, and statistical reporting. Misinterpretation can lead to incorrect reimbursement, flawed quality metrics, and potentially impact future treatment decisions based on inaccurate historical data. The correct approach represents best professional practice because it prioritizes accurate and complete documentation as the foundation for coding. By seeking clarification from the physician, the coder adheres to the principle of coding to the highest level of specificity supported by the medical record, as mandated by ICD-10-CM official guidelines for coding and reporting. This ensures that the assigned codes accurately reflect the patient's condition and the services rendered, aligning with regulatory requirements for accurate medical record keeping and billing. This proactive communication also fosters a collaborative relationship with the physician, improving the overall quality of documentation and coding. An incorrect approach that involves assigning a code based solely on the patient's chief complaint without physician confirmation fails to meet the requirement for coding to the highest degree of certainty. This is a regulatory failure as it deviates from the principle of coding based on documented diagnoses and conditions. Ethically, it misrepresents the patient's condition. Another incorrect approach, such as coding a more severe or definitive diagnosis without explicit physician documentation, constitutes a significant regulatory and ethical breach. It is a form of upcoding, which can lead to fraudulent billing and misrepresentation of patient acuity. A third incorrect approach, which is to code a less specific or symptom-based code when a more definitive diagnosis is documented or implied, also represents a regulatory failure by not coding to the highest specificity and can lead to underreporting of conditions, impacting quality measures and research. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review all available documentation to understand the patient encounter. Second, identify any ambiguities or missing information that prevents accurate code assignment. Third, consult the ICD-10-CM official guidelines for coding and reporting for relevant instructions. Fourth, if ambiguity persists, query the physician for clarification, providing specific details about the information needed. Fifth, once clarification is received, assign the codes based on the updated documentation and guidelines. This iterative process ensures compliance, accuracy, and ethical practice. Question 5. The evaluation methodology shows a scenario where a medical coder is presented with documentation for a patient receiving a portable oxygen concentrator. The documentation specifies the duration of use and the prescribed oxygen flow rate. The coder identifies several HCPCS level Roman II codes that appear to relate to oxygen equipment. To ensure accurate claim submission, which of the following actions best reflects adherence to coding guidelines and professional practice? Option A. Choose a generic DME code if a specific code for a portable oxygen concentrator is not immediately apparent, to avoid claim delays. Option B. Review the HCPCS level Roman II codebook and payer policies to identify the most specific code that accurately describes the portable oxygen concentrator, its features, and prescribed usage as documented. Option C. Select the HCPCS level Roman II code that most closely matches the general category of oxygen equipment, assuming it will be accepted by most payers. Option D. Code based on the most common HCPCS level Roman II code used for oxygen concentrators in the practice, without further verification of specific documentation details. The correct answer is C. Select the HCPCS level Roman II code that most closely matches the general category of oxygen equipment, assuming it will be accepted by most payers. Explanation. The evaluation methodology shows a scenario where a medical coder must accurately apply HCPCS level Roman II codes for a durable medical equipment DME service. The professional challenge lies in discerning the most appropriate code when multiple codes might appear superficially relevant, especially when payer policies or specific product characteristics are not explicitly detailed in the provided clinical documentation. This requires a deep understanding of HCPCS Level Roman II coding guidelines, including the hierarchy of codes, modifiers, and the intent behind specific code descriptors. Careful judgment is required to avoid incorrect coding that could lead to claim denials, audits, or even fraud allegations. The correct approach represents best professional practice because it prioritizes adherence to official coding guidelines and payer-specific instructions. This involves thoroughly reviewing the documentation to identify all relevant details about the DME item, its intended use, and any associated services. Consulting the HCPCS Level Roman II codebook, including introductory notes and tabular list instructions, is paramount. If ambiguity exists, seeking clarification from the healthcare provider or payer is the ethically and professionally responsible action. This ensures accurate reimbursement and compliance with regulatory requirements, such as those enforced by CMS for Medicare beneficiaries. An incorrect approach that involves selecting the most frequently used code without verifying its specific applicability to the documented service is professionally unacceptable. This failure to perform due diligence violates the fundamental principle of accurate coding and can lead to significant financial penalties and reputational damage. Another incorrect approach, such as coding based on assumptions about the patient's condition rather than the documented service, directly contravenes the principle of coding what is documented. This can result in misrepresentation of services rendered and potential violations of anti-kickback statutes or other fraud and abuse regulations. Furthermore, choosing a code that is not specifically listed in HCPCS Level Roman II for the documented item, even if it seems similar, is a direct violation of coding rules and can lead to claim rejections and audits. Professional decision-making in such situations should follow a structured process. 1. Thoroughly review all available clinical documentation. 2. Identify the specific service or item being coded. 3. Consult the official HCPCS Level Roman II codebook, paying close attention to code descriptors, guidelines, and any applicable notes. 4. If multiple codes appear relevant, analyze the nuances of each code descriptor and the specific details of the documented service to determine the most precise fit. 5. If ambiguity persists or payer-specific policies are unclear, seek clarification from the ordering physician or the payer before submitting the claim. This systematic approach ensures accuracy, compliance, and ethical practice. Question 6. Market research demonstrates that a significant portion of claim denials stem from inaccurate coding related to specialized medical terminology. A registered medical coder, RMC, is presented with a physician's operative report detailing a laparoscopic cholecystectomy with intraoperative cholangiogram and exploration of the common bile duct for suspected cholecystectomy. Which of the following approaches best ensures accurate and compliant coding for this scenario? Option A. Code based on the most common diagnosis associated with a cholecystectomy, assuming the cholangiogram and duct exploration were standard components of the procedure, and use a general code for gallbladder disease. Option B. Prioritize the use of a single, comprehensive CPT code that might exist for complex laparoscopic gallbladder surgery, and a broad ICD-10-CM code for digestive system issues to expedite the coding process. Option C. Thoroughly review the operative report to identify all distinct procedures performed: laparoscopic cholecystectomy, intraoperative cholangiogram, common bile duct exploration, and the confirmed diagnoses, e.g., cholecystectomy. Then select the most specific CPT and ICD-10-CM codes for each documented element according to current coding guidelines. Option D. Identify the primary procedure, laparoscopic cholecystectomy, and assign the corresponding CPT code. Then locate a single ICD-10-CM code that broadly encompasses bile duct stones without further specificity. The correct answer is D. Identify the primary procedure, laparoscopic cholecystectomy, and assign the corresponding CPT code. Then locate a single ICD-10-CM code that broadly encompasses bile duct stones without further specificity. Explanation. Scenario analysis. This scenario is professionally challenging because accurately translating complex medical terminology from various specialties into standardized coding language is paramount for accurate billing, statistical analysis, and patient record integrity. Misinterpreting or misapplying terminology can lead to significant financial discrepancies, regulatory penalties, and flawed healthcare data. The RMC must possess a deep understanding of both the clinical context and the specific coding guidelines to ensure compliance and precision. Correct approach analysis. The correct approach involves meticulously reviewing the physician's documentation, identifying key diagnostic and procedural terms, and then cross-referencing these terms with the official coding manuals, e.g., IC 10cm, CPT, to select the most specific and appropriate codes. This process ensures adherence to regulatory requirements for accurate medical record documentation and billing, as mandated by governing bodies for healthcare coding. It reflects best professional practice by prioritizing accuracy, specificity, and compliance with established coding standards. Incorrect approaches analysis. One incorrect approach would be to rely solely on common abbreviations or layman's terms found in the documentation, without verifying their precise medical meaning and corresponding code. This fails to meet the regulatory requirement for specificity in coding and can lead to the assignment of inaccurate or less specific codes, potentially resulting in under- or overbilling and noncompliance with payer guidelines. Another incorrect approach would be to assign codes based on assumptions about the patient's condition, without explicit documentation from the physician. This violates ethical principles of accurate representation and regulatory mandates for coding to the highest degree of certainty documented by the provider. It can lead to fraudulent billing practices and misrepresentation of patient care. A further incorrect approach would be to use outdated or unofficial coding resources that do not reflect the current regulatory framework. This directly contravenes the requirement to use the most current and approved coding systems, leading to non-compliance with established coding standards and potential rejection of claims by payers. Professional reasoning. Professionals should approach medical coding by first understanding the clinical narrative presented in the documentation. They must then systematically identify all relevant diagnoses, procedures, and services. Each identified element should be translated into its most specific code, using the official coding manuals. This process requires continuous professional development to stay abreast of coding updates and regulatory changes. When in doubt, consulting with a supervisor or seeking clarification from the physician is a critical step in ensuring accuracy and compliance. Question 7. Which approach would be most effective for an RMC auditor to identify significant coding compliance issues within a large hospital's outpatient department, considering limited audit resources? Option A. Implement a risk-based audit plan that prioritizes complex cases, high-volume services, and areas with recent coding guideline updates. Option B. Audit only the coding charts of the most senior and experienced medical coders in the department. Option C. Focus audits exclusively on claims that have been denied by insurance payers within the last billing cycle. Option D. Conduct a random audit of 10% of all outpatient charts submitted in the last quarter, regardless of complexity or service type. The correct answer is A. Implement a risk-based audit plan that prioritizes complex cases, high-volume services, and areas with recent coding guideline updates. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding auditing, balancing the need for thoroughness with the practical constraints of time and resources. The auditor must identify coding errors that could lead to financial discrepancies or compliance issues, while also ensuring the audit process itself is efficient and effective. The pressure to complete audits quickly without sacrificing accuracy requires a strategic and well-defined approach. Correct approach analysis. The correct approach focuses on a risk-based methodology. This aligns with best practices in auditing and regulatory expectations, which prioritize areas with the highest potential for error or noncompliance. By concentrating efforts on complex cases, high-volume services, or areas with recent changes in coding guidelines, the auditor maximizes the impact of their work. This approach is efficient, cost-effective, and directly addresses the most critical areas of potential risk, thereby supporting the organization's commitment to accurate coding and regulatory compliance as mandated by RMC standards. Incorrect approaches analysis. One incorrect approach involves auditing a random selection of charts without considering the complexity or potential risk associated with each case. This method is inefficient as it may dedicate significant time to simple, low-risk cases while overlooking more problematic ones. It fails to demonstrate a strategic allocation of resources and may not effectively identify systemic issues or significant financial vulnerabilities, thus not meeting the professional obligation for diligent auditing. Another incorrect approach is to solely focus on the most experienced coders. While experienced coders are generally proficient, errors can still occur, and focusing exclusively on them might lead to overlooking potential issues with less experienced staff who may require more targeted training and support. This approach is not comprehensive and could create blind spots in the auditing process, failing to ensure consistent coding quality across the entire department. A further incorrect approach is to only audit claims that have been denied by payers. While denied claims are important indicators of potential coding problems, this reactive approach misses opportunities to identify and correct errors before a claim is submitted. This can lead to ongoing revenue leakage and increased administrative burden from claim resubmissions, failing to proactively ensure coding accuracy and compliance. Professional reasoning. Professionals should adopt a risk-based auditing strategy. This involves identifying high-risk areas, e.g., new services, complex procedures, areas with frequent guideline changes, or services with high reimbursement rates, and prioritizing audits in these areas. This systematic approach ensures that limited resources are used most effectively to identify and mitigate the greatest potential compliance and financial risks. It also allows for targeted education and process improvement based on identified trends. Question 8. The review process indicates that a patient is eligible for both Medicare and Medicaid. The medical record documents a physician visit for a chronic condition management. The coder is unsure which payer should be billed first for this service. Option A. Bill Medicare as the primary payer, as per standard coordination of benefits rules for dual-eligible beneficiaries, and then submit a secondary claim to Medicaid if applicable. Option B. Bill Medicaid first, as they are often the payer of last resort for services not fully covered by Medicare. Option C. Bill both Medicare and Medicaid simultaneously for the same service to ensure prompt payment. Option D. Code the service without considering payer guidelines, assuming one of the payers will process the claim. Correct answer is A. Bill Medicare as the primary payer, as per standard coordination of benefits rules for dual-eligible beneficiaries, and then submit a secondary claim to Medicaid if applicable. Explanation. This scenario is professionally challenging because it requires a medical coder to navigate the nuances of Medicare and Medicaid guidelines, specifically concerning the appropriate reporting of services for beneficiaries with dual eligibility. Misinterpreting these guidelines can lead to improper billing, potential claim denials, and non-compliance with federal regulations, impacting both provider reimbursement and patient access to care. The coder must exercise careful judgment to ensure accurate coding that reflects the services rendered and adheres to the payer's specific rules. The correct approach represents best professional practice because it prioritizes accurate identification of the primary payer, according to Medicare and Medicaid coordination of benefits rules. Medicare is generally the primary payer for most services for individuals eligible for both Medicare and Medicaid, unless specific exceptions apply. By identifying Medicare as the primary payer and billing accordingly, the coder ensures compliance with the established payer hierarchy, which is a fundamental principle of Medicare and Medicaid billing. This approach minimizes the risk of claim rejections and ensures that the provider receives appropriate reimbursement from the correct payer. An incorrect approach that involves billing Medicaid first without verifying payer status or coordination of benefits rules is a significant regulatory and ethical failure. This violates Medicare's coordination of benefits provisions, which dictate the order in which payers are responsible for claims. Such an action could be considered fraudulent if done intentionally to circumvent payer rules, and it demonstrates a lack of diligence in understanding and applying federal healthcare regulations. Another incorrect approach, such as billing both Medicare and Medicaid simultaneously for the same service without proper coordination, is also a regulatory failure. This can lead to duplicate billing and overpayments, which are violations of federal anti-fraud and abuse laws. It indicates a misunderstanding of the claims submission process and the requirement to follow established payer sequencing. Finally, an incorrect approach that involves simply coding the service without considering payer guidelines or the patient's dual eligibility status is a failure in professional responsibility and due diligence. This demonstrates a lack of understanding of the complexities of coding for dual-eligible beneficiaries and a disregard for the specific requirements of government payers. It can result in incorrect billing, claim denials, and potential audits, all of which negatively impact the healthcare organization. The professional reasoning process for similar situations should involve a systematic approach. 1. Verify patient eligibility and payer status for all applicable insurance plans. 2. Consult Medicare and Medicaid coordination of benefits guidelines to determine the primary and secondary payers. 3. Apply the correct coding and billing procedures based on the identified primary payer. 4. If a secondary payer is involved, follow their specific billing requirements for secondary claims. 5. Document all payer information and decisions thoroughly in the patient's record. 6. Stay updated on changes to Medicare and Medicaid regulations and payer policies. Question 9. The analysis reveals that a surgeon performed a laparoscopic cholecystectomy with intraoperative cholangiogram and a separate exploration of the common bile duct. The operative report clearly details the steps for each of these distinct procedures. Which of the following approaches best reflects accurate CPT coding guidelines for this scenario? Option A. Report only the CPT code for the laparoscopic cholecystectomy, as the other services are considered integral to the primary procedure. Option B. Report the CPT code for the laparoscopic cholecystectomy and the CPT code for the exploration of the common bile duct, as the cholangiogram is considered part of the bile duct exploration. Option C. Report the CPT code for the laparoscopic cholecystectomy, the CPT code for the intraoperative cholangiogram, and the CPT code for the exploration of the common bile duct, ensuring appropriate documentation supports each service. Option D. Report the CPT code for the laparoscopic cholecystectomy and append a modifier to indicate the additional services performed. The correct answer is A. Report only the CPT code for the laparoscopic cholecystectomy, as the other services are considered integral to the primary procedure. Explanation. The analysis reveals a scenario where a medical coder must accurately assign CPT codes for a complex surgical procedure involving multiple distinct services performed during the same operative session. The professional challenge lies in discerning which services are separately reportable and which are integral components of the primary procedure, thereby avoiding both undercoding, leading to lost revenue, and overcoding, leading to fraud and abuse. Careful judgment is required to interpret operative reports, understand CPT guidelines, and apply the principles of medical necessity and distinct procedural services. The correct approach represents best professional practice because it meticulously reviews the operative report to identify each distinct service performed. It then consults the CPT manual, specifically looking for guidelines related to surgical packages, bundled services, and modifier usage. By correctly identifying services that meet the criteria for separate reporting, e.g., performed at different sites, distinct from the primary procedure, or requiring separate instrumentation/skill, the coder ensures accurate reimbursement while adhering to regulatory requirements. This approach prioritizes patient care documentation and compliance with CPT coding conventions, which are foundational to ethical and legal medical billing. An incorrect approach that focuses solely on the primary procedure code without scrutinizing the operative report for additional distinct services would be a regulatory failure. This could lead to underreporting of services, violating the principle of accurate financial representation of healthcare provided, and potentially impacting the provider's revenue. Another incorrect approach, which incorrectly bundles services that are explicitly defined as separately reportable by CPT guidelines or payer policies, also constitutes a regulatory and ethical failure. This demonstrates a lack of understanding of coding principles and could lead to financial discrepancies and audit issues. Furthermore, an approach that applies modifiers without proper documentation or medical necessity justification, or misinterprets the intent of modifier usage, represents a significant ethical and regulatory breach, potentially leading to fraudulent billing practices. The professional decision-making process for similar situations should involve a systematic review of the operative report, cross-referencing with CPT guidelines and any relevant payer policies. Coders should develop a strong understanding of surgical package definitions, bundled services, and the appropriate application of modifiers. When in doubt, consulting with a senior coder coding supervisor, or seeking clarification from the physician regarding the documentation is crucial. This iterative process of review, research, and clarification ensures the highest level of coding accuracy and compliance. Question 10. Strategic planning requires a medical coder to accurately assign current procedural terminology, CPT, codes for services rendered. When a physician performs multiple distinct procedures during a single patient encounter, what is the most appropriate and compliant method for determining the correct CPT codes to report? Option A. Select the codes that appear most straightforward or commonly used in the practice's billing software, prioritizing speed of entry. Option B. Assign the codes that the physician most frequently uses for similar procedures, assuming these are generally accepted. Option C. Rely on the physician's verbal confirmation of the procedures performed without independently verifying against coding resources. Option D. Consult the official CPT manual and National Correct Coding Initiative, NCCI, edits to identify appropriate codes and modifiers, ensuring all services are accurately represented according to established guidelines. The correct answer is D. Consult the official CPT manual and National Correct Coding Initiative, NCCI, edits to identify appropriate codes and modifiers, ensuring all services are accurately represented according to established guidelines. Explanation. This scenario is professionally challenging because accurately assigning CPT codes is fundamental to proper medical billing and reimbursement, directly impacting healthcare provider revenue and patient financial responsibility. Misinterpreting or misapplying CPT guidelines can lead to claim denials, audits, and potential legal repercussions. The core of the challenge lies in understanding the nuances of CPT coding, particularly when multiple procedures are performed during a single encounter. The correct approach represents best professional practice because it prioritizes adherence to the official CPT coding guidelines and the National Correct Coding Initiative, NCCI, edits. These resources are established by the American Medical Association (AMA) and the Centers for Medicare and Medicaid Services, CMS, respectively, and are the definitive authorities for correct coding in the United States. By consulting these authoritative sources, the coder ensures that the codes assigned accurately reflect the services rendered, are medically necessary, and comply with federal regulations. This minimizes the risk of claim rejections, audits, and fraud allegations, thereby upholding ethical coding standards and financial integrity. An incorrect approach that focuses solely on the physician's documentation without cross-referencing official coding guidelines is professionally unacceptable. This fails to account for established coding rules that may dictate how multiple procedures are reported, such as modifier usage or bundling edits. It risks assigning codes that are not compliant, leading to potential overpayment or underpayment, and can be construed as a failure to exercise due diligence in coding. Another incorrect approach that involves guessing or relying on anecdotal advice from colleagues bypasses the established regulatory framework. This is ethically unsound and professionally negligent. CPT coding is a regulated practice, and deviations from official guidelines can result in significant penalties, including fines and exclusion from federal healthcare programs. It demonstrates a lack of commitment to professional standards and a disregard for the legal implications of incorrect coding. A further incorrect approach that prioritizes speed over accuracy by assigning the most common codes without thorough review is also professionally unacceptable. While efficiency is desirable, it must not compromise the integrity of the coding process. This approach can lead to significant errors, as the most common code may not accurately represent the specific service provided, especially in complex cases. It reflects a lack of attention to detail and a failure to meet the professional obligation to accurately report healthcare services. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all physician documentation, including operative reports, progress notes, and diagnostic test results. 2. Identify all distinct procedures and services performed. 3. Consult the current year's CPT manual to identify potential codes for each service. 4. Critically evaluate the identified codes against the CPT guidelines, including any applicable parenthetical notes and instructional statements. 5. Cross-reference with NCCI edits to identify any bundling issues or required modifiers. 6. If ambiguity exists, Consult official AMA coding resources or seek clarification from a coding supervisor or compliance officer. 7. Assign codes that most accurately and completely describe the services rendered, adhering strictly to all applicable regulations and guidelines. Question 11. Governance review demonstrates a medical coder is tasked with assigning ICD-10-CM and CPT codes for a patient encounter. The physician's documentation lists several medications, including a new prescription for an anticoagulant and a pre-existing medication for a condition that could be exacerbated by the new anticoagulant. The documentation does not explicitly state the physician's assessment of the potential drug interaction or the specific therapeutic intent for prescribing the anticoagulant in light of the pre-existing condition. Which of the following approaches best aligns with professional coding standards and regulatory requirements for this scenario? Option A. Assign codes based on the listed medications, assuming the physician has considered all potential interactions and is managing the patient appropriately. Option B. Query the physician for clarification regarding the therapeutic intent of the anticoagulant and any assessment of potential drug interactions, then code based on the physician's response and complete documentation. Option C. Refuse to assign codes for the encounter until the physician provides a detailed pharmacological report on all prescribed medications. Option D. Code the encounter based on the pre-existing condition and the new anticoagulant, inferring a potential drug interaction as a secondary diagnosis without physician confirmation. The correct answer is B. Query the physician for clarification regarding the therapeutic intent of the anticoagulant and any assessment of potential drug interactions, then code based on the physician's response and complete documentation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical coder to interpret and apply complex pharmacological information within the strict confines of U.S. regulatory frameworks, specifically the Health Insurance Portability and Accountability Act, HIPAA, and relevant coding guidelines, e.g., CPT, ICD-10-CM. The coder must ensure accurate documentation and coding to support appropriate reimbursement while maintaining patient privacy and adhering to payer-specific policies. Misinterpretation of drug interactions or therapeutic classes can lead to incorrect coding, potentially resulting in claim denials, audits, or even fraud allegations. Correct approach analysis. The correct approach represents best professional practice because it prioritizes accurate and complete documentation as the foundation for correct coding. By consulting the physician for clarification on the intended therapeutic intent and potential drug interactions, the coder ensures that the coding reflects the patient's actual clinical condition and treatment plan. This aligns with the principle of documentation drives coding and adheres to the ethical obligation to code truthfully and accurately, as mandated by professional coding organizations and payer guidelines. Furthermore, it respects patient privacy by not making assumptions or coding based on incomplete information, thus upholding HIPAA principles. Incorrect approaches analysis. One incorrect approach involves coding based solely on the listed medications without seeking clarification on their purpose or interaction. This fails to meet the standard of accurate coding, as it may misrepresent the patient's condition or treatment. It could lead to incorrect reimbursement and potential payer scrutiny, violating principles of truthful billing. Another incorrect approach is to assume a specific therapeutic intent or interaction without physician confirmation. This bypasses the physician's clinical judgment and can lead to coding errors that do not accurately reflect the patient's care. This is a direct violation of coding best practices and can result in significant compliance issues. A third incorrect approach is to refuse to code the encounter due to perceived ambiguity, without attempting to resolve the ambiguity through appropriate channels. While caution is important, a complete refusal to code without seeking clarification hinders patient care and reimbursement processes. Professional coders are expected to actively seek clarification to ensure accurate coding, rather than abandoning the task. This approach fails to uphold the coder's responsibility to facilitate accurate billing and reporting. Professional reasoning. Professionals should adopt a systematic approach. 1. Review all available documentation thoroughly. 2. Identify any ambiguities or missing information related to diagnoses, procedures, or pharmacological treatments. 3. Consult relevant coding guidelines and payer policies. 4. If ambiguity persists, query the physician or appropriate healthcare provider for clarification, clearly stating the information needed. 5. Document the query and the physician's response. 6. Code the encounter based on the clarified and complete documentation. This process ensures accuracy, compliance, and ethical practice. Question 12. During the evaluation of a physician's progress note, the coder encounters the term myelopathy. The physician's documentation does not explicitly state inflammation, but describes a general dysfunction of the spinal cord. The coder must accurately translate this into an ICD-10-CM code. Which of the following interpretations of the term myelopathy is most accurate for coding purposes, considering the root word and common medical terminology? Option A. Myelopathy refers to a disease of the spinal cord, encompassing various conditions affecting its function. Option B. Myelopathy is synonymous with myelitis, indicating an inflammatory process of the spinal cord. Option C. Myelopathy is a general term for any condition affecting the myel part of the nervous system, regardless of location. Option D. Myelopathy solely refers to conditions originating in the bone marrow that affect the spinal cord. The correct answer is A. Myelopathy refers to a disease of the spinal cord, encompassing various conditions affecting its function. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a potential misinterpretation of medical documentation due to a subtle but significant difference in a medical term's root word. The coder must rely on their understanding of anatomical and pathological terminology to accurately translate the physician's notes into billable codes. A failure to correctly identify the root word could lead to incorrect coding, impacting patient care documentation, billing accuracy, and potentially leading to compliance issues. The ethical imperative is to ensure accurate representation of the services rendered. Correct approach analysis. The correct approach involves recognizing that myelopathy refers to a disease of the spinal cord, while myelitis refers to inflammation of the spinal cord. By correctly identifying myelopathy as the root condition, the coder can accurately select the ICD-10-CM code that reflects a general disease of the spinal cord, rather than a specific inflammatory process. This aligns with the principle of accurate medical coding, which is a cornerstone of ethical practice and regulatory compliance under the RMC framework, ensuring that documentation precisely reflects the physician's diagnosis. Incorrect approaches analysis. One incorrect approach would be to assume myelopathy and myelitis are interchangeable in code based on the assumption of inflammation. This is a regulatory failure because it deviates from the precise meaning of the root word myel, bone marrow or spinal cord, and the suffix pathy, disease, versus itis, inflammation. This leads to inaccurate coding, violating the RMC's requirement for precise documentation. Another incorrect approach would be to code based solely on the presence of myel, without considering the full term and its established medical definitions. This demonstrates a lack of understanding of how prefixes, suffixes, and root words combine to form distinct medical terms, leading to a failure to meet the RMC standard for comprehensive medical terminology knowledge. A further incorrect approach would be to guess the meaning or consult unreliable sources. This is a significant ethical and regulatory failure. The RMC framework mandates adherence to established coding guidelines and accurate interpretation of medical documentation. Relying on guesswork or unverified information compromises the integrity of the coding process and violates the RMC's responsibility to uphold professional standards. Professional reasoning. Professionals should approach such situations by meticulously dissecting the medical term, identifying the root word, prefixes, and suffixes, and cross-referencing with authoritative medical dictionaries and coding manuals. When in doubt, seeking clarification from the physician or a coding supervisor is the most responsible course of action. This systematic approach ensures accuracy, compliance, and ethical integrity in medical coding. Question 13. The risk matrix shows a high probability of coding errors due to insufficient detail in physician progress notes regarding the severity of a patient's chronic condition. The coder has identified that the documentation does not clearly specify if the condition is stable, worsening, or if new complications have arisen, which could impact the assignment of a more specific ICD-10-CM code. What is the most appropriate course of action for the registered medical coder? Option A. Proceed with coding based on the most common severity level for that condition, as indicated by general medical knowledge. Option B. Assign a less specific ICD-10-CM code that reflects the general presence of the chronic condition, assuming it is stable. Option C. Query the physician for clarification on the severity and status of the chronic condition to ensure accurate code assignment. Option D. Omit coding the chronic condition entirely as its severity is not clearly documented. The correct answer is C. Query the physician for clarification on the severity and status of the chronic condition to ensure accurate code assignment. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where incomplete or ambiguous clinical documentation directly impacts the accuracy and compliance of coded data. The professional challenge lies in balancing the need for timely claim submission with the ethical and regulatory imperative to ensure all codes accurately reflect the patient's encounter. Misinterpreting or omitting information due to poor documentation can lead to downstream consequences, including incorrect reimbursement, potential audits, and patient safety concerns if diagnoses are not fully captured. Careful judgment is required to identify documentation gaps and address them appropriately without introducing bias or speculation. Correct approach analysis. The correct approach involves proactively seeking clarification from the healthcare provider to obtain complete and accurate documentation. This aligns with the core principles of medical coding, which mandate that codes assigned must be supported by documented evidence in the patient's medical record. Regulatory frameworks, such as those governing Medicare and Medicaid in the U.S. e.g. CMS guidelines, HIPAA, emphasize the importance of accurate coding for proper reimbursement and data integrity. Ethically, coders have a responsibility to ensure the integrity of the medical record and the accuracy of the information conveyed through coding. By seeking clarification, the coder upholds these standards, ensuring that the final coded data is precise, defensible, and compliant with all applicable regulations. This proactive measure prevents the submission of potentially inaccurate claims and fosters a collaborative relationship with providers to improve documentation quality. Incorrect approaches analysis. One incorrect approach is to proceed with coding based on assumptions or incomplete information. This is a direct violation of regulatory requirements that mandate codes to be supported by documentation. It can lead to upcoding or downcoding, resulting in improper reimbursement and potential fraud or abuse investigations. Ethically, it breaches the coder's duty to accurately represent the patient's condition. Another incorrect approach is to omit services or diagnoses that are suspected but not clearly documented. While this avoids overcoding, it can lead to underreporting of patient acuity and services rendered, impacting provider reimbursement and potentially obscuring the true scope of care provided. This also fails to meet the regulatory expectation of capturing all documented conditions and services. A third incorrect approach is to delay claim submission indefinitely until perfect documentation is received. While thoroughness is important, excessive delays can negatively impact provider revenue cycles and may violate payer timely filing limits, leading to denied claims. This approach fails to balance accuracy with operational efficiency and contractual obligations. Professional reasoning. Professionals should approach documentation challenges by first identifying the specific information missing or unclear. They should then consult internal coding guidelines and payer policies for direction on handling such situations. The primary recourse is always to query the provider for clarification. If a query is not feasible or does not yield sufficient information, coders should follow established facility or organizational policies for handling incomplete documentation, which may involve assigning a less specific code if appropriate and documented, or flagging the record for further review. The decision-making process prioritizes regulatory compliance, ethical integrity, and accurate representation of patient care, while also considering operational efficiency. Question 14. The assessment process reveals that a medical coder is tasked with submitting claims for a complex surgical procedure. The healthcare provider is participating in a bundled payment model for this specific procedure, which aims to reimburse a single, all-inclusive payment for all services related to the surgery, from preoperative care to postoperative recovery. The coder must determine how to accurately represent the services rendered to align with this reimbursement methodology. Which of the following best reflects the coder's responsibility in this scenario? Option A. Code the primary surgical procedure and any significant, separately identifiable services performed, ensuring that the documentation clearly supports the medical necessity and distinct nature of each coded item within the bundled payment framework. Option B. Identify the specific bundled payment code that encompasses all services related to the surgical procedure and submit this single code, relying on the payer's internal reconciliation process for individual component payments. Option C. Focus on coding only the most resource-intensive services performed during the episode of care, as these are typically the primary drivers of reimbursement within bundled payment models. Option D. Accurately code all individual services performed during the entire episode of care, ensuring each service is documented and billed according to its standard fee schedule to maximize reimbursement. The correct answer is D. Accurately code all individual services performed during the entire episode of care, ensuring each service is documented and billed according to its standard fee schedule to maximize reimbursement. Explanation. The assessment process reveals a common challenge in medical coding, accurately applying reimbursement methodologies to complex patient encounters. This scenario is professionally challenging because it requires not just knowledge of coding guidelines, but also a nuanced understanding of how different reimbursement models impact payment, necessitating careful judgment to ensure compliance and financial integrity. The correct approach represents best professional practice because it prioritizes adherence to the specific regulatory framework governing reimbursement for the services rendered. This involves a thorough understanding of the payer's policies, the applicable coding system, e.g., IC 10cm, CPT, HCPCS Level Roman II, and the nuances of the chosen reimbursement methodology, e.g., fee-for-service, bundled payments, capitation. By accurately reflecting the services provided and aligning them with the established reimbursement rules, the coder ensures that the healthcare provider receives appropriate compensation while maintaining compliance with all relevant laws and guidelines. This upholds ethical standards by preventing both undercoding and overcoding, which can have significant financial and legal repercussions. An incorrect approach that focuses solely on maximizing reimbursement without regard for the specific methodology or supporting documentation would be a regulatory and ethical failure. This could lead to allegations of fraud or abuse, violating regulations such as the False Claims Act or Anti-Kickback Statute, depending on the jurisdiction. Another incorrect approach, such as applying a reimbursement methodology that is not applicable to the service or payer, would also be a failure, as it would result in inaccurate billing and potential claim denials, undermining the financial stability of the practice and potentially violating payer contracts. A third incorrect approach, prioritizing speed over accuracy in coding to meet productivity targets, risks significant coding errors, leading to incorrect reimbursement and potential compliance issues. Professional decision-making in such situations requires a systematic approach. First, identify the specific payer and the contracted reimbursement methodology. Second, thoroughly review the patient's medical record to capture all documented services and diagnoses. Third, apply the appropriate coding guidelines and conventions for the services rendered. Fourth, cross-reference the coded information with the requirements of the reimbursement methodology to ensure accurate claim submission. Finally, stay updated on changes in coding and reimbursement regulations through continuous education and professional development. Question 15. Regulatory review indicates a physician requests a medical coder to change the documented diagnosis code for a patient encounter to reflect a more severe condition than what is explicitly supported by the medical record, stating it will improve reimbursement. The coder is concerned this request is unethical and potentially illegal. Which of the following actions best represents the coder's professional responsibility in this situation? Option A. Immediately report the physician to external government regulatory agencies without first attempting to resolve the issue through internal compliance channels. Option B. Comply with the physician's request to change the diagnosis code to the more severe condition to ensure appropriate reimbursement, as the physician is the ultimate authority on patient care. Option C. Ignore the physician's request and proceed with coding based on the original, less severe diagnosis code, without further communication or escalation. Option D. Refuse to alter the documentation and escalate the concern to the organization's compliance officer or designated privacy/security officer, documenting the request and the refusal. Correct answer is D. Refuse to alter the documentation and escalate the concern to the organization's compliance officer or designated privacy/security officer, documenting the request and the refusal. Explanation. This scenario presents a professional challenge due to the inherent conflict between a coder's duty to accurately report services and the pressure to potentially misrepresent services for financial gain or to meet productivity targets. The coder must navigate this ethical tightrope while adhering to strict regulatory guidelines. The correct approach, which involves refusing to alter the documentation and instead escalating the concern through appropriate channels, represents best professional practice because it upholds the core ethical principles of medical coding: accuracy, integrity, and compliance. This aligns with the RMC's responsibility to ensure that all coded data accurately reflects the services rendered, as mandated by federal regulations such as the False Claims Act and the Anti-Kickback Statute, which prohibit fraudulent billing practices. Furthermore, professional coding organizations' ethical guidelines emphasize the coder's obligation to report truthfully and to avoid any actions that could lead to misrepresentation of services. Escalating the issue ensures that the discrepancy is addressed at a higher level, protecting both the coder and the organization from potential legal and financial repercussions. An incorrect approach that involves complying with the physician's request to change the documentation without proper justification would be a direct violation of coding ethics and federal regulations. This constitutes fraudulent billing, as it misrepresents the services provided to the payer, potentially leading to overpayment. Such an action undermines the integrity of the healthcare billing system and exposes the coder and the organization to severe penalties, including fines and exclusion from federal healthcare programs. Another incorrect approach, such as ignoring the request and continuing to code based on the original, potentially inaccurate documentation, fails to address the ethical dilemma proactively. While it avoids direct complicity in misrepresentation, it does not resolve the underlying issue of inaccurate documentation and could still lead to improper billing if the original documentation is indeed flawed. This passive approach does not fulfill the coder's ethical obligation to ensure accurate reporting and to address potential compliance issues. Finally, an incorrect approach that involves immediately reporting the physician to external regulatory bodies without first attempting to resolve the issue internally through established compliance channels would be premature and potentially damaging. While whistleblowing is a protected right, the professional decision-making process typically involves exhausting internal resolution mechanisms first, unless there is an immediate and severe risk of harm or ongoing fraud that cannot be addressed internally. This approach bypasses the organization's own compliance infrastructure, which is designed to handle such issues. The professional decision-making process for similar situations should involve: 1. Understanding the documentation and the request. Clearly identify the discrepancy and the requested change. 2. Consulting coding guidelines and regulations. Verify the correct coding principles and relevant laws. 3. Communicating with the requester. Politely and professionally explain the coding rules and why the requested change cannot be made without proper documentation. 4. Escalating the issue. If the request persists or if there is a clear intent to misrepresent services, follow the organization's established compliance reporting procedures. 5. Documenting all interactions. Keep a record of all communications and actions taken. Question 16. Cost-benefit analysis shows that a particular coding practice, while potentially increasing revenue by a significant margin, relies on a subtle interpretation of documentation that could be challenged during an audit. As a registered medical coder, RMC, you have identified this discrepancy. What is the most ethically and regulatorily sound course of action? Option A. Discuss the discrepancy with the physician and request clarification or additional documentation to ensure accurate and compliant coding, even if it delays the billing process. Option B. Code the services in a manner that maximizes reimbursement, assuming the physician's interpretation of the documentation is correct and the potential revenue gain outweighs the minimal audit risk. Option C. Immediately implement the higher revenue coding practice, as the physician's professional judgment should be trusted implicitly in such matters. Option D. Report the services based on the most favorable interpretation of the documentation that can be reasonably supported, even if it means a slightly lower reimbursement, to ensure absolute compliance. The correct answer is B. Code the services in a manner that maximizes reimbursement, assuming the physician's interpretation of the documentation is correct and the potential revenue gain outweighs the minimal audit risk. Explanation: this scenario presents a professional challenge because it forces a medical coder to balance financial incentives with ethical and regulatory obligations. The pressure to maximize revenue, even through potentially questionable coding practices, conflicts directly with the RMC's duty to ensure accurate and compliant billing. Careful judgment is required to navigate this conflict without compromising integrity or violating regulations. The correct approach represents best professional practice because it prioritizes adherence to the RMC's regulatory framework, specifically focusing on the principles of accurate coding and documentation. This approach upholds the integrity of the healthcare billing system and protects both the provider and the patient from fraudulent or erroneous claims. It aligns with the core ethical responsibilities of a medical coder to report services truthfully and in accordance with established guidelines. An incorrect approach that involves overlooking the discrepancy in documentation to facilitate a higher reimbursement fails to adhere to the fundamental principles of coding compliance. This action could be construed as deliberate misrepresentation of services rendered, violating regulations that mandate accurate coding based on documented services. Such a failure not only exposes the provider to potential audits, fines, and penalties, but also erodes the trust placed in the coding profession. Another incorrect approach, which involves coding based on the physician's verbal assurance without reviewing the supporting documentation, bypasses the essential requirement for objective, verifiable evidence. This can lead to inaccurate coding and billing, potentially violating regulations that require coding to be directly supported by the medical record. It also fails to exercise due diligence in ensuring compliance. A professional decision-making process for similar situations should involve a systematic evaluation of the situation against established coding guidelines and ethical principles. When faced with conflicting pressures or ambiguities, a coder should first seek clarification from the physician or appropriate administrative personnel regarding documentation. If the discrepancy cannot be resolved through clarification and still presents a compliance risk, the coder should escalate the issue to their compliance officer or supervisor. The ultimate decision must always be to code accurately and compliantly, even if it means foregoing potential additional revenue, as regulatory adherence and ethical practice are paramount. Question 17. The control framework reveals a physician's operative report describing a procedure involving the removal of a benign neoplasm from the patient's left kidney. The documentation uses the term nephrectomy in conjunction with benign neoplasm. Which of the following interpretations of medical terminology is most critical for accurate coding in this scenario? Option A. Recognizing that nephrectomy universally implies the complete removal of the kidney, regardless of the nature of the neoplasm. Option B. Assuming that benign neoplasm is a general term and does not require specific identification for coding purposes, as long as a surgical procedure was performed. Option C. Prioritizing the term nephrectomy over benign neoplasm to determine the primary diagnosis code, as the surgical procedure is the most significant clinical event. Option D. Understanding that benign neoplasm signifies a non-cancerous growth, and that the specific type and location of the neoplasm, along with the extent of the surgical intervention, partial vs. complete nephrectomy, are crucial for selecting the correct ICD-10-CM and CPT codes. Correct answer is A. Recognizing that nephrectomy universally implies the complete removal of the kidney, regardless of the nature of the neoplasm. Explanation: the scenario presents a challenge in accurately coding medical services due to the nuanced and potentially ambiguous nature of medical terminology used in patient documentation. Professional coders must possess a robust understanding of anatomical, physiological, and pathological terms to translate physician notes into standardized codes. Misinterpretation can lead to inaccurate billing, compliance issues, and potential audits. The correct approach involves a systematic process of identifying key medical terms, understanding their precise meaning within the clinical context, and then mapping them to the most appropriate ICD-10-CM and CPT codes. This requires not only knowledge of medical terminology, but also familiarity with coding guidelines and conventions. This approach represents best professional practice as it ensures data integrity, supports accurate reimbursement, and upholds compliance with regulatory requirements such as those mandated by the Centers for Medicare and Medicaid Services, CMS, for accurate medical record documentation and coding. An incorrect approach that relies solely on a superficial understanding of terms or a quick search, without considering the full clinical context, can lead to significant errors. For instance, confusing terms with similar spellings but different meanings, e.g., hypertrophy vs. hyperplasia, or failing to recognize that term's meaning can change based on its anatomical location or associated condition would be a failure. This would violate the principle of accurate representation of services rendered, potentially leading to upcoding or downcoding, both of which carry regulatory penalties. Another incorrect approach would be to assume a diagnosis or procedure based on a single term without corroborating documentation, which is a direct contravention of the documentation must support the code, principle inherent in all coding regulations. This could lead to fraudulent billing practices. Professionals should employ a decision-making process that prioritizes thorough review of the entire medical record, consultation with coding resources and subject matter experts when ambiguity exists, and adherence to official coding guidelines. This iterative process of review, interpretation, and validation is crucial for maintaining accuracy and compliance. Question 18. Implementation of accurate diagnosis-related group DRG assignment is critical for hospital reimbursement and quality reporting. A patient is admitted with symptoms suggestive of pneumonia, but subsequent diagnostic tests and physician documentation also indicate a significant comorbidity of chronic obstructive pulmonary disease, COPD, exacerbation that required specific treatment and prolonged the patient's length of stay. Which of the following approaches best ensures accurate DRG assignment in this scenario? Option A. Review the entire medical record, including all physician documentation, nursing notes, and diagnostic results, to identify all relevant diagnoses and procedures that impacted patient care and length of stay, and assign the DRG that most accurately reflects the patient's overall clinical condition and resource utilization. Option B. Assign the DRG based solely on the admitting diagnosis of pneumonia, as it was the primary reason for admission. Option C. Assign a DRG that is known to have a higher reimbursement rate if the patient's condition could be interpreted to fit that category, even if the documentation is not entirely definitive. Option D. Assign the DRG based on the preliminary diagnosis of pneumonia and await further physician clarification at a later date to make any necessary adjustments. The correct answer is B. Assign the DRG based solely on the admitting diagnosis of pneumonia, as it was the primary reason for admission. Explanation. The scenario presents a challenge in accurately assigning a diagnosis-related group, DRG, due to a potential discrepancy between the documented diagnosis and the patient's actual clinical presentation and treatment. This requires careful clinical and coding judgment to ensure the DRG reflects the complexity of care provided, which directly impacts reimbursement and quality reporting. The correct approach involves a thorough review of the entire medical record, including physician documentation, nursing notes, and diagnostic test results, to identify all relevant diagnoses and procedures. This comprehensive analysis allows for the selection of the most appropriate DRG that accurately captures the patient's principal diagnosis, secondary diagnoses that affected treatment or length of stay, and any significant procedures. This aligns with the principles of accurate coding and billing, ensuring compliance with payer guidelines and regulatory requirements for reporting patient care. It upholds ethical coding practices by preventing under- or overcoding, which could lead to inaccurate quality metrics or financial misrepresentation. An incorrect approach would be to solely rely on the admitting diagnosis without considering other documented conditions or procedures that significantly influence the patient's care. This could lead to an inaccurate DRG assignment, potentially misrepresenting the severity of illness and resource utilization. This failure to capture all relevant clinical information violates the principle of complete and accurate coding, which is a cornerstone of regulatory compliance and ethical practice. Another incorrect approach would be to assign a DRG based on a preliminary or unconfirmed diagnosis without waiting for definitive physician documentation. This premature assignment can lead to errors that require costly and time-consuming corrections, and it can also impact the accuracy of hospital quality data and performance metrics. This practice demonstrates a lack of adherence to established coding guidelines and a disregard for the importance of complete and finalized documentation before coding. Finally, an incorrect approach would be to assign a DRG that is known to be more lucrative, even if it is not fully supported by the documentation. This constitutes fraudulent billing and is a direct violation of federal and state regulations governing healthcare reimbursement. It undermines the integrity of the healthcare system and can result in severe penalties. The professional reasoning process in such situations should involve a systematic review of the medical record, consultation with the physician if documentation is unclear or conflicting, and adherence to official coding guidelines and payer policies. When in doubt, seeking clarification from a supervisor or coding expert is essential to ensure accurate and compliant DRG assignment. Question 19. The control framework reveals a discrepancy in the expected reimbursement for a recently submitted claim. The coder suspects that the initial coding may not have fully captured the complexity of the patient's condition and the services provided, potentially leading to a lower reimbursement than anticipated. The coder is considering several approaches to address this. Option A. Contact the patient directly to inquire about additional services they may have received that were not fully documented in the medical record. Option B. Review the complete medical record, including physician documentation, operative reports, and diagnostic test results, to ensure all documented services and diagnoses are accurately coded according to current coding guidelines and payer-specific policies. Option C. Immediately resubmit the claim with a higher-paying code for the primary diagnosis, assuming the physician intended for a more complex service to be recognized. Option D. Adjust the submitted codes based on common industry practices for similar cases, without a detailed review of the specific patient's documentation or payer policies. The correct answer is B. Review the complete medical record, including physician documentation, operative reports, and diagnostic test results, to ensure all documented services and diagnoses are accurately coded according to current coding guidelines and payer-specific policies. Explanation. This scenario presents a professional challenge because the medical coder must navigate the complex and evolving landscape of healthcare reimbursement, ensuring compliance with specific payer policies and regulatory guidelines while accurately reflecting the services rendered. The pressure to optimize reimbursement without compromising ethical coding practices requires a deep understanding of both clinical documentation and financial implications. The correct approach represents best professional practice because it prioritizes accurate coding based on comprehensive medical record review and adherence to established coding guidelines and payer policies. This ensures that claims submitted are truthful, complete, and justifiable, minimizing the risk of audits, denials, and potential penalties. It aligns with the ethical obligation of the RMC to uphold the integrity of healthcare data and financial reporting, fostering trust with payers and patients. An incorrect approach that focuses solely on maximizing reimbursement by upcoding or unbundling services is a direct violation of ethical coding standards and regulatory requirements. This constitutes fraudulent activity, as it misrepresents the services provided to obtain higher payment. Another incorrect approach, which involves submitting claims without thoroughly reviewing the medical documentation, risks undercoding or overcoding, leading to financial losses for the provider or incorrect billing to the patient, and can result in payer audits and penalties for noncompliance. A third incorrect approach, which relies on outdated or misinterpreted payer policies, can lead to claim rejections and revenue cycle disruptions, demonstrating a lack of diligence and up-to-date knowledge, which is a failure in professional competency. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's medical record, including physician notes, diagnostic reports, and treatment plans. This understanding should then be cross-referenced with current coding guidelines, e.g., CPT, IC 10cm, HCPCS Level Roman II, and the specific reimbursement policies of the relevant payer. When discrepancies or ambiguities arise, seeking clarification from the physician or the payer's provider relations department is a crucial step. Continuous professional development and staying abreast of regulatory changes are essential to maintaining compliance and ethical practice. Question 20. The assessment process reveals that a patient's operative report for a complex surgical procedure lacks specific details regarding the extent of tissue resection and the exact anatomical location of the excision, although the physician's daily progress note briefly mentions removal of abnormal tissue. What is the most appropriate course of action for the medical coder? Option A. Query the physician for specific details regarding the extent of tissue resection and the precise anatomical location of the excision to ensure accurate code assignment. Option B. Assign codes based on the general description in the progress note, assuming the physician performed a standard procedure. Option C. Report the procedure with a modifier indicating insufficient documentation, as per internal policy. Option D. Code the procedure using the most common code for tissue removal, without further inquiry, as the progress note indicates a procedure was performed. The correct answer is A. Query the physician for specific details regarding the extent of tissue resection and the precise anatomical location of the excision to ensure accurate code assignment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical coder to identify subtle yet significant documentation deficiencies that directly impact coding accuracy and compliance. The challenge lies in discerning between minor clerical errors and critical omissions that could lead to incorrect billing, potential audits, and regulatory penalties. The coder must possess a thorough understanding of coding guidelines and the clinical context to evaluate the documentation's completeness and specificity. Correct approach analysis. The correct approach involves meticulously reviewing the patient's medical record to identify specific documentation gaps that prevent accurate code assignment. This includes looking for missing diagnostic statements, insufficient detail regarding the procedure performed, or lack of supporting evidence for the services rendered. By identifying these precise errors, the coder can then query the physician for clarification or additional documentation, ensuring that the codes assigned accurately reflect the patient's condition and the services provided, thereby adhering to regulatory requirements for accurate and compliant coding. This aligns with the principles of accurate medical record documentation and billing as mandated by healthcare regulations. Incorrect approaches analysis. One incorrect approach is to assume that all documentation is sufficient and proceed with coding based on the available information, even if it is vague or incomplete. This fails to uphold the coder's responsibility to ensure accurate coding and can lead to misrepresentation of services, violating principles of honest billing, and potentially leading to overpayment or underpayment. This approach disregards the need for specificity required by coding systems and regulatory bodies. Another incorrect approach is to overcode or assign codes based on assumptions about the physician's intent without explicit documentation. This is a direct violation of coding guidelines that mandate coding based on documented facts. Such an approach can result in fraudulent billing practices, leading to severe penalties, including fines and exclusion from federal healthcare programs. It undermines the integrity of the coding process and patient care documentation. A third incorrect approach is to ignore minor documentation inconsistencies, believing they are inconsequential. While some minor issues might not immediately impact coding, a pattern of overlooking such errors can mask more significant problems. Furthermore, regulatory bodies often scrutinize documentation for completeness and accuracy, and even minor inconsistencies can be flagged during audits, leading to compliance issues. Professional reasoning. Professionals should adopt a systematic approach to documentation review. This involves understanding the payer's requirements, the specific coding guidelines for the services rendered, and the clinical significance of the documented information. When deficiencies are identified, the primary recourse is to query the physician for clarification or additional documentation. This collaborative process ensures that the coder has the necessary information to assign accurate codes while maintaining ethical and regulatory compliance. The decision-making process should prioritize accuracy, compliance, and the integrity of the patient's medical record.